occupational therapy portfolio topic, I'm going to be doing manual muscle tests on multiple parts of the body. So for this, my patient here is likely going to have a 5 out of 5 manual muscle test grade because I know that there's nothing wrong with her, but for my reference, I want to run through what all of the grades will look like. So for this example, I'm going to do elbow flexion. So standing here, I want you to bring your hands up to your shoulders just like that. Okay, so my patient has full range of motion against gravity, which tells me that she's at least a 3. So now we're going to do a 5. So I'm going to support you at the elbow. Okay, and again, I'm going to apply some pressure. Don't let me push you down. Go ahead. 3 Mississippi, 4 Mississippi, 5 Mississippi. Okay, so that would be a 5 out of 5. And now we'll do a 4. Okay, 3 Mississippi, 4 Mississippi. Okay, so she broke right around 4 Mississippi, which would be a 4. So with a 5, she was able to withstand maximum pressure. With a 4, she was able to resist moderate pressure. And now we'll do a 3 plus, okay? 3 Mississippi, so she broke on the 3, but I know that she can at least do full range of motion against gravity without pressure, which makes her already a 3, and she withheld it for a little bit longer, so she's able to withstand slight pressure. And now I'll show you a 3 minus, so go ahead and try to bring your hand up to your shoulder. Okay, so she's getting further than 50% of the way, just not full range of motion, which tells me that she has at least a 3 minus out of 5. And if she wasn't able to do at least 50% of the movement, I would go ahead and eliminate gravity. So now that I've eliminated gravity for elbow flexion using the table, I'm going to show you what those grades would look like. So we'll go ahead and I'll show you a 2, which is similar to the 3, where I'm just going to have her do the movement and see if she can get full range of motion just doing the movement. Go ahead. Okay, so she was able to get through the full range of motion, which tells me that without gravity, she's at least a 2. So now I'm going to go ahead and provide some resistance, so go ahead and do the movement. Okay, so because she was able to withstand some slight pressure, she's at least a 2 plus. And now to show a 2 minus, go ahead and do a 2 minus. Okay, so for a 2 minus, she's not getting full range of motion, she's only getting part of the range of motion. And then for a 1, I would ask her to do the movement. And if she wasn't able to produce the movement, what I would want to do is feel for a muscle that would contract during that movement. So I'm feeling her biceps contracting. So that would be a 1, is that I can feel or see that there's a contraction. And then for a 0, I would ask her to do the movement. If she was unable to produce the movement, I would go ahead and feel, ask her to do the movement again, and if I cannot feel or see a contraction, that would be a grade 0 out of 5 for manual muscle testing. Now I'm going to do manual muscle testing of the shoulder. So first we're going to start with shoulder flexion. So I just want you to bring your arms up as far as you can. Okay, and back down. I can see that she's got full range of motion for shoulder flexion against gravity, so I know she's at least a 3. Okay, so I'm going to place a hand here to stabilize, and I want you to do that motion again, and I'm going to apply some resistance on the way up. Don't let me break you, okay? Okay, all right. She has a 5 out of 5 for shoulder flexion. Okay, so now we're going to do shoulder extension. So yeah, I'm going to have you turn a little bit so the camera can see. So what I'm going to have you do is I'm going to have you bring your arms past you as far as you can, just like that. Okay, so full range of motion against gravity for shoulder extension, so at least a 3 out of 5. I'm going to apply some stabilization, and I want you to do that same motion again when I say go, and I'm going to apply some resistance. Go ahead. Okay, so she has a 5 out of 5 for shoulder extension. Now we're going to do abduction. So what I want you to do is I just want you to raise your hand out to the side all the way up to the top. There we go. Okay, full range of motion against gravity for shoulder abduction, so at least a 3 out of 5. So again, I'm going to apply some stabilization, and I want you to do that same motion, and I'm going to apply some resistance. Go ahead. Okay, she has a 5 out of 5 for shoulder abduction. And now we're going to do external rotation. So I want you to bring your arm out just like this, and then I want you to rotate it all the way to the top. I'm actually gonna correct you real quick if that's okay. I want you to start here and then go ahead and rotate all the way to the top. Great job, okay. Full range of motion against gravity for external rotation, so at least a 3 out of 5. So now I'm going to apply some, actually I'm going to stabilize here at the elbow. And I want you to do that same motion, and I'm going to apply you some resistance. Go ahead. Okay, and she has a 5 out of 5 for shoulder external rotation. Now I'm going to do manual muscle testing of the shoulder for internal rotation, horizontal adduction, and horizontal abduction. So first we're going to start with horizontal adduction. So what I'm going to do is I have my patient lying supine with your arm starting out here. What I want you to do is I just want you to bring it out in front of you, reach up toward the sky, above your face. There you go. Okay, so now I've seen that my patient has full range of motion against gravity for horizontal adduction, so she's at least a 3 out of 5. I'm going to apply some stabilization on the opposite shoulder. Okay, I want you to do that same motion again when I say go, and I'm just going to apply some resistance. Okay, go ahead. Okay, great job. You can let it down. So she got a 5 out of 5 for horizontal adduction. So now I'm going to have you flip over onto your stomach to lie prone. Okay, so first we'll start with horizontal abduction. So with, your arm starting out here, what I want you to do is reach it straight behind you, up into the air, just like that. Great. Okay, so now I've seen she's got full range of motion against gravity for horizontal abduction. So she's at least a 3 out of 5. So I'm going to apply some stabilization. I want you to do that same motion, and I'm going to apply some resistance. Don't let me push it down. Go ahead. Great job. Okay, so she's a 5 out of 5 for horizontal abduction. Now we're going to do internal rotation. So we're going to go ahead and start like this. And what I want you to do is I want you to sweep your hand down past toward your back pocket. Great. Okay. And now for this one, I'm going to have a seat here. I'm going to apply some stabilization under the arm. And I want you to do that same motion, but this time I'm going to apply some resistance. Go ahead. Great job. Okay, so my patients earned a 5 out of 5 for horizontal abduction, adduction, and internal rotation. Now I'm going to be doing a manual muscle testing of the elbow. So first we're going to do flexion. Go ahead and can you bring your hands up to your mouth just like that? Flex your elbows for me. She's able to do that against gravity, full range of motion, which tells me she's at least a 3. So now what I'm going to do is I'm going to stabilize here at the back of the arm. And what I want you to do is when I tell you to go, I'll have you do that motion again. And I'm going to apply a little bit of resistance. Still let me push it down, okay? Okay. Go. Okay. So once I applied some resistance, I counted 3 Mississippi, 4 Mississippi, 5 Mississippi to tell me that she is considered a 5. So now we're going to do extension. So what I want you to do is I want you to lift your arm up here and have your arm flexed. Now can you go ahead and extend like you're reaching up to a shelf, just like that. So I have the arm up here to show that my patient's able to extend against gravity. She's able to do that, full range of motion against gravity, which tells me she's at least a 3. So now what I'm going to do is I'm going to stabilize the arm. And when I tell you to go, I want you to extend your elbow, and I'm going to, again, apply a little bit of resistance. Okay. Go. Okay, and so for this patient, she is a 5 for elbow flexion and a 5 for elbow extension. Now we're going to do manual muscle testing of the forearm for supination and pronation. So what I want you to do is bend your elbow to 90 degrees like this. And for pronation, we'll go ahead and start with our hands in supination. And what I want you to do is follow me. We're just going to turn our palms toward the floor. Okay, so this shows me that my patient is able to do full range of motion, pronation against gravity. So now I'm going to have my patient in a neutral position, and I am stabilizing her on both sides of the arm here. And what I want you to do is I want you, when I say go, to turn your palm to the floor, and I'm going to apply some resistance. Okay, go. Okay, again, I counted from 3 to 5, and she was able to maintain that movement. So for pronation, she is a 5 out of 5. And now we'll do supinated. So we'll start here, and we're going to turn our palms up toward the sky. She's able to do supination, full range of motion against gravity. So again, I'm going to stabilize on each side of the arm. And when I say go, I want you to turn your palm up toward the sky, and I'm going to apply some resistance. Don't let me break you out of the movement. Okay? Go. Okay, so my patient has a 5 out of 5 for forearm, supination, and pronation. Now we're going to do manual muscle testing of the wrist. So first we're going to start with wrist flexion. So I want you to be here, and I just want you to flex your wrist up just like that. Okay, my patient's able to do that full range of motion against gravity. So now what I'm going to do is I'm going to support the forearm just like this. And what I'm going to have you do when I say go is bring your hand to your mouth again, and I'm going to apply some pressure at your palm. Okay? Ready? Go. Okay, so again, 3, 4, 5. My patient was able to do that. So my patient was a 5 out of 5 for wrist flexion. Okay, so then we're going to be here with our palms down, pronated. And what I want you to do is extend your wrist back up just like that. Okay, my patient's able to do wrist extension, full range of motion against gravity, which tells me she's already a 3. So again, what I'm going to do is I'm going to support the forearm. And again, I'm going to have you, when I say go, bring your wrist up, and I'm going to apply some pressure, okay? Go. Okay, my patient is a 5 out of 5 for wrist extension as well. Now we're going to do radial deviation. So now we're going to be here with our thumbs toward the sky. And what I want you to do is I just want you to rotate your hands up without moving your forearms, okay? My patient's able to do radial deviation, full range of motion against gravity, which tells me she's at least a 3. So now I'm going to stabilize the forearm again. And when you do this, this time I'm going to apply some pressure. Okay. I'm actually going to apply my pressure just right underneath your thumb here, okay? Okay. And go. Okay. My patient has a 5 out of 5 for radial deviation, and now we're going to do what's called ulnar deviation. So I'm actually going to have you bring your hand up near your ear so that your pinky is on the top of your hand near the ceiling. And what I want you to do is I just want you to rotate your hand up just like that. My patient's able to do ulnar deviation, full range of motion against gravity. So what I'm going to do now is I'm going to actually stabilize the forearm here. I'm going to place my hand here, and when I say go, I want you to do that same motion, and I'm going to apply some pressure. Okay. Go. Okay, so my patient has demonstrated a 5 out of 5 for wrist flexion, wrist extension, radial deviation, and ulnar deviation. Now I'm going to do manual muscle testing of the knee and hip for flexion and extension. So first we're going to start with extension. So what I want you to do from this seated position for extension is I just want you to extend your knee out like that. Great, and back down. So she's able to do full range of motion against gravity for knee extension, which tells me she's at least a 3. So now what I'm going to do is I'm going to support right behind the knee back here underneath the thigh. And this time I want you to, when I say go, extend your knee again, and I'm going to apply some resistance this time. Don't let me push you down. Okay? Ready? Go. Okay? So my patient has a 5 out of 5 for a knee extension, and now we're going to do knee flexion. So I'm going to have my patient in a prone position for knee flexion. Okay? So now what I want you to do with your right leg is I want you to bring your heel to your bottom. Okay? So my patient is able to demonstrate full range of motion against gravity for knee flexion, which tells me she's at least a 3. So now what I'm going to do is stabilize above the knee, and this time when I say go, I want you to bring your heel to your bottom again, and I'm going to apply some resistance. Okay. Go. Okay. So my patient has demonstrated a 5 out of 5 for knee flexion and extension. Now we're doing manual muscle testing of the hip for hip flexion, external rotation, extension, and abduction. So first, I've got my patient in a seated position. We're going to start with flexion. So all I want you to do is I want you to take your knee and I want you to bring it up toward the sky, just like that. Fantastic. So now I've seen that my patient has full range of motion of hip flexion against gravity, so I know she's at least a 3. So I'm going to apply a hand here to stabilize, and when I say go, I want you to do the same thing with your knee, and I'm going to apply a little resistance, and don't let me push you down. Okay, go. Okay, so my patient has a 5 out of 5 for knee flexion. Okay, now for external rotation, you're sitting here, and I'm just going to lift my leg up as an example. What I want you to do is I want you to bring your foot in, over, across the other leg for external rotation. Okay, now I've seen that my patient can do full range of motion of external rotation against gravity, so she's got at least a 3 out of 5. So now I'm going to get down here, and I'm just going to place this hand on the outside of her thigh to avoid her from using her leg to push outward to be able to get the foot to go further up. So again, I want you to do the same thing, except this time I'm going to apply a little bit of resistance, and don't let me push you down. Okay, and go. Okay, so my patient has earned a 5 out of 5 for hip external rotation. So now what we're going to do is move to the couch for hip extension and hip abduction. So we'll do hip extension first. Very similar to knee extension, except what I want you to do is I want you to, with this leg, I want you to lift your entire leg up off the couch toward the sky. There we go. Okay, so my patient has demonstrated full range of motion against gravity for hip extension. So she has at least a 3 out of 5. So I'm going to come here, apply stabilization, and I want you to go ahead and lift your leg up again, and I'm going to apply resistance. Go ahead. Okay, my patient has earned a 5 out of 5 for hip extension. So now my patient's going to be side lying for hip abduction. So what I want you to do first is I want you to lift this leg up toward the ceiling as far as you can. Fantastic. Okay. Now my patient has shown a full range of motion against gravity for hip abduction. So I know that she's at least a 3 out of 5. So again, some stabilization, and I want you to do the same thing, but this time I'm going to apply resistance, okay? Go ahead. Okay, so my patient has demonstrated a 5 out of 5 for hip flexion, external rotation, extension, and abduction.